Hello and welcome to today's webinar. My name is Gaston Tesada, and we are blessed to host you by His Presence Dr. Francisco Contreras and Dr. Paulina Larraga. Before we begin, I want to thank you guys for joining us to today's webinar. I just want to know that the chat's working and everything. Can you put in the chat box or in the Q&A section your name and where you're from? We'd like to know where our guests are visiting from, participants are visiting from. It's always, we have a very international audience always, so it's always good to know. We have Yvette from California. Thank you. And Amy, it's going so fast. Amy from Minnesota. We got Robert from London. We got Gail from Kentucky. Oral from Jamaica. My goodness, Jamaica. Miami. We got Virginia, Tennessee. It's going so fast. Too fast for me. But thank you so much. Okay, so today's webinar is going to focus on hypothermia and ozone treatments. We can talk about the Warburg effect also, if it comes to that topic also. But I want to thank you guys for joining us today. And we're going to do a quick presentation with Dr. Contreras and Dr. Paulina Larraga, and then we are going to head into our most popular section, which is the Q&A with our oncologist and medical coordinator. Dr. Contreras is the medical director and president of the Oasis of Hope Hospital, and Dr. Paulina Larraga, she's been with us for a couple of years now. We love her. She is the medical coordinator for the oncology department here at Oasis. And there's a lot of cancer wisdom here. And we're ready for your questions. And we're going to start off with Dr. Contreras and Dr. Paulina for their presentation. Go ahead.
So, Dr. Otto Warburg is the only doctor that has obtained 2 Nobel Prizes for medicine. There's another one, Linus Pauling, who had 2 Nobels as well, but one for medicine and one for peace or
Nobel Peace Prize.
Nobel Peace Prize. What is it that Dr. Otto Warburg discovered? He discovered that malignant cells convert into, at that time, he called it plant cells. And so what is the difference between a human cell and a plant cell? A human cell metabolizes carbohydrates through the aerobic system or with oxygen. And as you probably know, plants actually, instead of being activated by oxygen, they're activated by CO2. And which means that malignant cells are very hypoxic. And when a cell converts from aerobic into anaerobic, many things change. The metabolism of that tissue changes. And so he discovered that malignant cells shield themselves from oxygen. Now, when that happens, the metabolism of carbohydrates, as I mentioned, changes dramatically, and it becomes very inefficient in the obtention of energy. So benign cells or normal cells, for every unit of carbohydrates, they produce 32 units of energy. A plant cell or an anaerobic cell, like a malignant cell, for every unit of carbohydrate only produces 2 units of energy. And so malignant cells become bullies for sugar. They need a lot of sugar in order to produce the energy sufficient to survive, and they need more energy than normal tissue because their proliferation rate or their growth rate is much faster than with normal tissues. And later, we discovered that the most efficient way to kill cancer cells, contrary to Linus Pauling, whom I mentioned, that obtained a Nobel Prize in medicine for the discovery of the structure of hemoglobin, He posed that since the production of energy anaerobically makes the cells very oxidant, that have oxidative stress, that the best way or a way to kill them would be to antioxidating them. And so he's the one that proposed the use of high dose vitamin C. At that time, it was called megadoses of vitamin C as an antioxidant to put the cells, malignant cells, outside of their comfort zones. And a couple of studies were done with stage 4 cancer patients. And the ones that received the mega dosages of vitamin C actually lived a whole year longer than the ones that did not receive it. Years later, it was discovered that it was virtually impossible to antioxidate a cancer cell.
Okay.
And thus, the theory of using an antioxidant like vitamin C made no sense.
Is it because antioxidation in long periods of time is very difficult because the body kind of regulates itself? Or
No, the whole environment does not allow the antioxidation to happen. And in fact, we already knew before this that the easiest way or a very efficient way to kill cancer cells is through oxidation. So instead of trying to bring down the oxidation, you actually stress more of the oxidative uh, elements, and you can kill cancer cell with that. And in fact, the the mode of action of all radiation therapies, uh, proton beam, liquid radiation, the new type, or the cobalt, the oldest type, is through oxidation that it kills the malignant cell. And the actual killing agent of radiation is peroxide. And there are a number of chemotherapeutical agents that also kill cancer cells through oxidative stress. All of this to come to the conclusion that many years later, so in the late 90s, a group of researchers led by the head of research of the NIH, Mark Levin, that has nothing to do with the political analyst. He said there must be something in vitamin C because the fact is that the patients live longer. And he discovered actually that vitamin C in very high dosages in the presence of oxygen converts from antioxidant at low dosages to oxidant in high dosages. So high dose vitamin C, as we know it now, is an oxidative therapy, which is kind of mind-boggling because normally vitamin C is an antioxidant. And one of the major principles of pharmacology is that the difference between a venom and a cure is not the substance, but the amount, right? So water is very good for us, but in high amounts, we can kill ourselves with water, right? Because it would provoke brain edema and so on and so forth. So they discovered in the late 90s and early 2000s that high dose vitamin C would convert itself into an oxidant and actually kill malignant cells with the same mode of action as chemotherapy and radiation therapy. And that's the beauty of vitamin C because radiation therapy and chemotherapy have very severe side effects, and vitamin C does not have any side effects whatsoever. So we're going to be talking today mostly, as Gaston said, about hyperthermia and ozone therapy. Why did I explain to you a little bit about the Warburg effect? Because these two elements, although directly they can kill cancer cells, ozone and hyperthermia, we use them here to augment the oxidative stress of the cells. So even though hyperthermia will kill cancer cells, you need to have it for a very long time. It's quite dangerous to the patient because the temperatures have to be above 41 degrees Celsius in order to really be effective. And so we use hyperthermia for about half an hour to 45 minutes at those temperatures to increase the oxidative stress so that the vitamin C can be more effective. And in order for vitamin C to actually convert itself into chemotherapy, oxygen has to be within the tumor tissue. Otherwise, it doesn't work. And I mentioned to you that malignant cells are plant-like, and they are hypoxic or anoxic in many. And so if you want to provoke oxidation without oxygen, it doesn't happen. So there is only one element known to date that actually can increase the level of oxygen in tumor tissue, in malignant tissue. We did many studies in the late 80s and 90s here, trying to increase the oxygen level in our bodies. And you can do it with aerobic exercises. That's why they're called aerobic. And we even had patients breathing 100% oxygen. And yes, we increase the level of oxygen in blood overall, but
Not with
the levels within the tumor did not increase, and the results were not good.
How do you measure oxygen levels within tumor tissue? Is there a test for that?
Oh, yes, there's a test for that. It's done in very specialized laboratories, and we trust those studies. It's very expensive to do.
Mhm.
Okay, so the only element to increase the concentration of oxygen within the tumor tissue is ozone. And that's why ozone is a major part of our therapy in order for vitamin C to really work. Okay? So we use hyperthermia to increment the oxidative stress of all of the tissues, but especially the malignant tissue. And we use ozone to increase the amount of oxygen within the tumor tissue for the vitamin C to convert itself into a very strong anti-tumor agent similar to chemotherapy or radiations.
So is hyperthermia usually done post vitamin C?
No, we use we want to do it either before or during.
Or during, okay.
Yeah. And so it's the combination of all of these therapies that make our metabolic protocol really very, very effective.
Right.
So I hope that with this explanation, at least now you have the background and the scientific background of why vitamin C in high dosages is effective, and that the most effective way of killing malignant cells is through oxidative stress.
Great. You know, I've been working here for about 17, 18 years now, and I learn something new every day. That's for sure. I kind of knew that, but when you explain it that way, it's a lot better. Dr. Clint, do you want to add anything to or do you want to jump into
Just a little, and I think this is very important because when patients ask, like, what was the element that caused the response of the treatment? And we really don't know because it's the combination of everything. Every therapy has their own role. Because like Dr. said, if we just want to treat a patient just with hyperthermia, we will need to increase temperature, make it for long term. That will not be possible. Mm-hmm. So when we combine and we do a combination of therapies that will change the environment of the tumor, that will oxidate the tumor, that will create tumor destruction, that's when we can expect like the responses that we have.
Yes. So, yes. Another background bit of information is that the actual killing agent of radiation therapy and high dose vitamin C is actually hydrogen peroxide.
Okay.
So for years, what we did was actually give hydrogen peroxide to our patients.
IV or orally?
IV, orally.
Anyway, yeah.
Any way that we could, way before your time. But the results were not there. Mm-hmm. And in the late 90s, a couple of papers were published that our body produces catalase. Catalase is an enzyme that neutralizes peroxide. So if you drink or IV peroxide, virtually our body neutralizes it
Okay.
immediately. But tumor tissue generally is low in catalase. That's why the oxidation has to be produced within the tumor tissue, and that's the beauty of vitamin C. So why do not 100% of the patients respond well to these therapies? Because there are tumors that have high catalase levels, and they will neutralize the peroxide that is produced within the tumor, and thus the patient will not respond. And that's, again, one of the things that Dr. Larraga mentioned. We are not relying
On just one.
absolutely on one thing. We're trying to hit cancer from many, many other areas.
Yeah, because in my time here, I've seen a lot of treatments be tried out and some let go. But vitamin C and ozone have been they've never gone away. I mean, different modalities of ozone, like Ibu and ozone saline, autochemotherapy.
Yeah. And the reason for that is that the numbers prove that a very high rate of patients
Respond positive.
respond positive.
Got it. Well, that was a great presentation, Dr. Contreras and Dr. Larraga. I really appreciate that. We're going to go into our Q&A session, the most popular section of our webinar. Sorry about that. And we got a lot of questions. We're going to try to get through all of them. So please begin asking your questions. We'll try to get through all of your questions. And if anything is not answered, I do want to just let everybody know that we have an admissions department here that can take all of your questions, and we provide free Zoom consultations to all interested patients or family members that have questions about the OASIS support protocols, and it's at no cost. So all you need to do is call our 800 number or go online and fill out one of our contact forms. One of our admissions coordinators will contact you. And all we need is your medical records, pathology report, imaging, lab work, and we can set you up with a free Zoom consultation at no cost, like I said. So take advantage of it. And you might get Dr. Larraga on the phone, or Dr. Contreras. You never know. You might be lucky. But we have a rotation of doctors on the phone. So thank you so much. And I want to do a shout out to Dottie and all of the Oasis of Hope hospital patients that are in the infusion room right now. And they are watching us, and I think they learn as much as we do. So we'll start off with the first question. Kurt is asking, have you treated neuron endocrine cancer, slow growing variety?
Yes, so there are basically two families of neuroendocrine tumors, the very aggressive variety and then the slow growing tumors. Yes, we've treated many. Usually the best treatment for those is surgery. And if it's found in early stages, even when the tumors are large, the surgery is one of the best treatments for these type of tumors. But we have a lot of experience with neuroendocrine of both types.
Right. It's a follow-up question from Kurt. I think he fired off a couple questions fast. So if he's asking if oxygen is good, have you vetted chlorine dioxide?
Yes, we've tried chlorine dioxide many years ago, and we didn't find it to be as effective as ozone in increasing the amount of oxygen, especially in tumor tissue. And as I tell you, it's a very difficult test to do, but many substances have been tested to increase the level of oxygen within tumor tissue, and the best one is ozone, and it's not the only one.
Quick question about ozone. I mean, there's a lot of different applications of ozone. Also, because we get a lot of patients that say, no, I want to do vitamin C back home, or want to do ozone back home. So, and they always get confused with the amount of dosage and the time of infusion. For vitamin, there's also non-GMO vitamin C. There's GMO vitamin C. Does that play a part into it, everything, or is that just more of a?
I'll let Dr. Lara talk about the ozone because there's many experts, and she's our expert in that. But yes, there is a claim that GMO altered vitamin C or source of vitamin C will have a different uh, structure, and all elements have a movement,
Okay.
rotary movement, and some will move clockwise and others will move anti-clockwise,
Counter.
clockwise, and physically that changes the chemistry of the element. Even though it may be exactly the same element, the way it rotates will make it effective or ineffective. And there are some studies that show that GMO altered products or foods that have high vitamin C content, where we obtain the vitamin C, they will rotate counterclockwise, and thus are not effective or not as effective as natural elements.
That's interesting.
So, and there's a few publications about it. If you're interested, you can look them up. And so that's why here we only use organic vitamin C sources.
Great. Dr. Paulina, take it away with ozone. I know it's a big subject.
Yes.
Yes.
So for ozone, we have many, not only modalities to do, but also dosage. And I think that's one of the importance, because depending on the treatment that we are, is the ozone that we can provide to the patient. We have 3 types of dosage, basically. That is the mild, the moderate, and the high. When we do metabolic therapy, that we want to cause oxidation, we do very high dose, because we don't want to counteract the effect of vitamin C, of B17. But at this dose, because we increase the reactive oxygen species, we can also suppress some lymphokines, not lymphocytes, lymphokines, that we want them to be active during cell therapy. So when we are very near from blood cell collection or in actual cell therapy, then we need to reduce the dose. So when the patient is back home, it will depend if we want an anti-inflammatory effect, or if we want to keep the immune system active, or if we want to promote again the oxidative process. So basically the micrograms will depend on where the patient's state is. So here, depending on how the patient is reacting, and also where in what part of the treatment is the micrograms that we use.
And that's key, because the personalization of treatment is what's really causes the impact on it, right? So I've noticed that as patients go along the treatment like life cycle, I mean, it always starts modifying, like more vitamin C, less vitamin C, or more ozone, less ozone, EBU, not autochemotherapy. And it's always very every journey is different, right?
Correct.
Got it.
And so the important thing, I think, to address as far as the dosage, is that you cannot obtain the high dosages for oxidative stress with insufflated ozone sources, intravaginally or intrarectally.
Correct.
That's not going to be sufficient for the purpose that we want.
Okay.
It may be very effective for other problems, right? But as far as being an adjuvant for oxidative stress therapy, you need high dosages, which can only be obtained with either autohematotherapy or EBU. To a certain point, right? With saline solutions that are ozonated, but it's not going to be as effective. So that, again, it doesn't mean that insufflated ozone is not beneficial, right?
Okay.
Or that lower dosages are not beneficial. For instance, I don't know if you know this, but in Las Vegas, all the casinos, when you arrive, everybody's smoking, and you don't even smell, right? It's because they have them ozonated.
Okay.
And they ozonate those to keep the smoke down, but also to excite the patient,
To keep them up,
wake them up, so that they can make. Well, it's the old school. Now it's LED buttons. So there are many uses of ozone, It can be very effective for many, many things. Here we concentrate, because we're an oncological center, on the type of ozone therapy that will reach the amounts that we need in order to promote oxidative stress.
Perfect. I love it. I love it. Anything you want to add? Yeah, go ahead. Yeah.
Device that
I
we
saw your face, your eyes. You're like, don't cut me off there. Yeah. Yeah.
just with the new device that we have for selling ozone, then we are able to keep on track on the oxidative dosage.
Dr. Paulina is an
Yeah.
avid fan of almost anything.
Not only a fan, she's an
She is
expert.
an expert in it.
She's our expert.
I mean, we've been trying to look at a 10 pass also. The new one that blood goes in, blood goes out. I mean, I'm not a doctor, but I only play one on TV. So I'm not reading it or no. Thank you so much for that. I appreciate it. Talk to me about Chris asking, let's go to Matt's asking, in your opinion, what is iron's role in killing cancer cells through ferroptosis?
Wow.
Ferroptosis? I think it's,
Oh, yes,
I
yes.
don't know what that word is. That's what time. Yeah.
We have not used that therapy. We have no experience with it. Some years ago, when I was doing some research, I did read about it. And
Iron or ferroptosis?
well, the iron therapy or increasing the amount of iron has some anti-tumor effect.
Okay.
Or some therapies are not going to be as effective if the iron levels are low. That's what I remember. I need to review this whole theme. But the short answer is we don't use it. And all I can remember now is that there are many other things that can be a lot more effective than iron therapy.
And I remember that with iron is also controversial, like glutathione, for example, because I don't recall exactly what therapy, but you should suppress any iron supplementation because it can cause the opposite effect. So I know that also iron is a little bit, maybe depending on the tumor type.
And that's why we don't give any glutathione to our cancer patients. Again, not that glutathione is not good, but it's not the best adjuvant for an anti-tumor therapy.
Does it proliferate cancer cells?
It can.
It can? Like NADs, like NADs and those new treatments. Okay, got it. Edith's asking, what treatments do you recommend for CLL? Chronic
lymphocytic leukemia. Conventional therapies are quite effective for all tumor circulating or circulating tumors. So generally, we are going to use chemotherapy. The chemotherapy for chronic leukemias is not as aggressive, and in many cases, patients don't even need any treatment because chronic leukemias can be very mild, and so only when the patient has some symptoms will you give therapy. Our treatment has not proven to be very effective in these type of malignancies, and so that's why we only use our treatment for preconditioning the patient to chemotherapy. So what does that mean? It means that the patient is going to be better prepared to receive the chemotherapy in the sense that the patient will experience much less side effects and much less damage to the collateral damage to the normal tissue from the onslaught of chemotherapy. But generally, all circulating tumors like leukemias, we will combine them with chemotherapy because they're tumors that generally respond well to conventional therapies.
Variety. Mary is asking, I missed this. Is it recorded? It's being recorded. We're live right now, and it will be up on our YouTube channel and our Facebook channel tomorrow afternoon. As soon as we get it just edited, give us a day or so. Audrey's asking, how is ozone administered? I think we covered this a little, but it's either autohemotherapy, ozonated saline, or the newest one, the very popular one is EBU, the extracorporeal blood ozonated. What is that? The other word?
The other
EBU stand for extracorporeal
Oh,
blood ozonated oxygen, or
no.
what is the other EBU? The other O.
The other O.
Anyway, you can Google it. You can Google it. Yeah. Okay. Anita's asking, what is considered high dose vitamin C, and is sauna a good form of heat?
So high dose vitamin C is a therapy where at least 50 grams of vitamin C are used. And the studies go from 10 grams to 100 grams. We use here at the Oasis of Hope 60 grams, but we use them in tandem of 30 first and then a half an hour, another 30. The vitamin C has lifespan within the body as an anti-tumor agent. And so 100 grams has a lasting effect of about 8 to 9 hours of anti-tumor effect. And so we notice that when we use 30 grams, we get to a peak. And then when it starts coming down, we give the other 30 grams. And so our camel-like graph reaches about 9 to 10 hours with 40 grams less. And so we make it a lot more efficient and less expensive for the patient. So that's why we use this method to prolong the activity, anti-tumor activity effectively with less dosage. The other advantage is that vitamin C has to be administered at a very fast rate. If you do not administer it at a gram per minute, you will never get the levels for it to be converted into an oxidant. And so 100 grams, you have to give it in 100 minutes. And it's a big stress to the heart. So the exclusion of patients with any type of heart disease is very high, or heart insufficiency, with 100 grams, whereas with 30 grams, most patients can tolerate it. And so we divide it into two, and it's as effective with as 100 grams. And so more patients are eligible for that type of therapy than 100 grams.
All right. Tracy is asking a very personalized question. She says, I have longevity ozone generator. Are you familiar with that? Longevity ozone? I mean, it could be.
That will a medical device. That will take the oxygen from the environment.
Like
the environment, and just like a humidifier.
You're right.
I had breast cancer stage 2 in 2014, and I want to do ozone for maintenance. I understand that I should not use ozone on my vitamin C IV days. Is it correct?
I'm not sure that is correct. Well, you're using then vitamin C as an antioxidant.
Yeah, it's for maintenance.
Yeah, then yes, that is correct.
Oh, that is correct, Tracy. All right. So the second part of Vanita's question was, is sauna a good form of heat?
Sauna is
infrared, right?
It's actually quite beneficial as a detoxifying agent and also immune stimulating agent. Mm-hmm. But sauna will not get the temperatures to the level where a malignant cell is going to be affected.
Okay.
Or not sufficient to really increase the oxidative stress. So it is good for health, but not necessarily as an anti-tumor agent. Now, if you have infrared, the infrared has more benefits to a cancer patient than the typical just heat. Mm-hmm. If you have any form of cancer, I would recommend to use infrared sauna rather than the typical sauna.
Got it. Do all infrared saunas have photobiomodulation effects? Photobiomodulation? Or not all of them? Or is that
No, it depends on the type of
depends on the
Exactly. It's like Dr.
Of
said.
waves.
Exactly. The type of wave.
Okay.
That are like long and short wave.
All right. Diane is asking, is this for all cancers? I've heard neck squamous cell carcinoma. I have head and neck squamous cell carcinoma. I did HBOT, which is hyperbaric oxygen, right? Yeah. And they stopped it due to swelling.
I'm not sure that the hyperbaric chamber provokes more inflammation. It might, but I doubt it. I think it's just inflammation caused by the tumor activity. And ozone therapy has proven to increase the amount of oxygen within the tumor tissue as well as hyperbaric chambers. So I think hyperbaric chambers can be a good thing for you, and maybe you need to find out why this inflammation appeared. I'm not convinced that it was the hyperbaric chamber that caused that.
Could it be because of the atmospheres that went down? Or
No, I doubt it.
Yeah. Because hyperbaric is an anti-inflammatory, right?
Generally, yes.
Yeah.
It'll be up.
All right. Okay, then yeah, it's something that we should. Diana's call us and let us know more questions. I mean, it's
Yeah, as I tell you, I doubt that it was the inflammation was caused by the hyperbaric chamber.
okay. Mirka's asking, can you do ozone treatments as preventative medicine?
Yeah, there's no question about it. There are people that have like this humidifier type where they ozonate the rooms like they do in Las Vegas, and I think it's a good thing to do. Ozone has proven to be a very strong antiviral, antibacterial. It has many benefits. The only limitation is that, like in the humidifier type, the dosage has to be quite low because ozone can be very irritating to the airways.
Okay. All righty. CP's asking, and I haven't heard about this before, is Inus a better option than Ibu? Inus pheresis?
Inus
Pheresis.
It is.
Let me Google that.
Yeah.
It is specialized innovative therapeutic apheresis. Blood
like a
filtration. I think it's more of a machine that does apheresis. Double membrane filtration system to harmful substances. Well, I think it's more of a
detox, cleansing, right?
Yeah. Yeah. So
I think there will be different mechanisms.
Yeah.
Okay. Yeah. It's more for autoimmune, long COVID. Yeah.
Yeah. Well, ozone therapy is, as I mentioned, it has the capacity of killing bacteria and viruses, and maybe this machine just increases that possibility.
It's like the hemodetox, those like environmental toxins
to cleanse
cleanse the blood.
To cleanse the blood.
It's very popular nowadays. Those treatments.
Yeah.
Alrighty. Vicky. Yeah. But before that, we just want to give a shout out to Gail Williams. She says that she was an Oasis patient here. She is an Oasis patient from 2020 and waiting to return. So Gail, we got you. Call us.
Yeah. Blessings.
Blessings, Gail. We're getting a lot. Do you have any experience with ozonized glycerine treatments such as injections, IV, or topical?
Topical, we do have a lot of experience. We used to produce our own cream here. Now we obtain it from a laboratory in Canada, and they ozonize virtually olive oil. And that keeps the ozone within the olive oil. And so when you apply it in lesions that are open, it's very effective, especially when you have ulcerated tumors that become very infected. Ozone cream is excellent. What was the other one?
The glycine. I started because a patient asked. It's basically a method where you suppose that you hold the molecule together longer than usual because the the ozone tends to separate into oxygen very quick.
Yes.
So glycine tends to
So it's just
keep a little bit longer.
a different type of oil than olive oil.
Yeah, too.
Yeah, so there's no question that that oils will keep ozone from
Dissipating.
exactly dissipating. It's a very unstable molecule that immediately goes into oxygen. So if you can keep it as ozone, it's going to be more effective, and that's the purpose of putting it into oil. So they're just using glycine as instead of olive oil.
Great. Keep the questions coming, guys. This is amazing. Vicky is asking, I made a mistake of getting a colonoscopy several days before a PET scan. My last scan was clear. This scan results show 3 somewhat enlarged lymph nodes with SUV of 4.45 to 5.5. I don't know if the lymphoma may be returning or this is an inflammation response from the procedure. I did some research that says that this is most likely the inflammation response. Do you concur?
Yeah, yes, the SUVs are too low. There's no question that a colonoscopy will irritate everything in the abdomen, both by the sheer aggressiveness of the tube going in, but then the air that has to be insufflated in order for you to see, and also usually before the colonoscopy, a cleanse is done that can also provoke inflammation. So I really believe that those lymph nodes are just irritated from the preparation and the procedure itself.
All right. AD is asking, would you treat colorectal dysplasia with ozone rectal insufflation?
That's a very good question. I have no experience with that. It sounds that it could be, but I'm not the expert. Have you heard anything about that?
When you want to reach the oxidative dosage that is above 50 micrograms, the epithelium of the colon suffers. So you can cause actually bleeding. So that's why it's not recommended to do ozone birectal, even when systemically it's very good. But at the dose that we use, it's not recommended because it will affect.
It would be interesting to find out what's the dosage that they're recommending to use, probably a low dose. And it may be beneficial, but again...
Yeah, like maybe anti-inflammatory,
right,
immune stimulant, but nothing more.
There's nothing more. Yeah.
All right. Now this is, I don't know if we're going to be able to answer this question, but Anita's asking, and this is a Dr. Paulina question for sure. Have you used modified citrus pectin for cancers? I've never heard of that.
No.
Pectin for cancers, not that I heard.
No, we use a lot of enzymes, and pectin is one of them.
But I know it's more
supplements, yeah.
Anti-inflammatory, like for
Yeah.
pain. We use it more for pain, but
Yeah.
not that I have heard for cancer.
No,
it shows promise in cancer research for its ability to inhibit tumor growth, metastasis, and resistance to chemotherapy, primarily targeting the protein glycine-3. Studies suggest it can be potential therapeutic agent with positive results observed in preclinical models of breast, colon, and prostate cancer. I mean, it's a supplement, right?
Yeah.
It's a supplement, yeah. So,
Yeah.
I mean...
It shouldn't be any problem for you to take it.
Yeah. Do you recommend taking high dose, Audrey's asking, do you recommend taking high doses of vitamin C for prevention?
No.
Because you don't have anything.
You just use the normal dose.
Which should be like 5 to 15, or...
1 to 5 grams a day, and 5 grams is already too much.
And if somebody wants to do IV vitamin C just for prevention, you wouldn't recommend it?
No.
Nope. Okay.
Not necessary.
Lizette's asking, where can we access this video after? Like I said before, on our YouTube channel, Oasis of Hope Hospital, or on our Facebook page, Oasis of Hope also. So yeah, be sure to subscribe to both. What do we look for when getting infrared? in terms of the machine, I think she's asking, or
Oh, yeah, the type of waves that it has?
The far or the near infrared.
Correct.
Yeah, the far normally will stimulate the lymphatic system to cause detoxification, to eliminate or help, the lymphatic system to eliminate circulating tumor cells. And the near tends to have a more like apoptotic effect, tumor destruction. So normally the far infrared is the one that you can get like any place that will promote detoxification, but the near one, it will be the most similar
Right.
to what
To
we
the
are
one we have here.
to the
So
one
that's more therapeutical.
Yeah.
Right. Jim's asking, what are the things you can do to strengthen your immune system to fight against cancer?
Well, there are many things that you can do to improve the quality and quantity of your immune system. I think that the first thing that you need to do is to stop using or consuming elements that are going to impede the work of the immune system. And so that's probably a way to look at it. There are many ways that you can increase or improve the quality of your immune system. And it goes from the very simple ones like laughter, just being a happy person.
Exercise.
Exercise is paramount, a good diet. And then you can look at supplements that are very specific to improve the immune system. And so mushrooms, there's a combination of mushrooms that are very effective in improving the immune system. There are other supplements as well, but for instance, sauna has proven to increase the capacity of your immune system.
How many times do you use sauna, infrared sauna, a month? And we have a
So
question.
you can use it every day if you want to.
Okay.
And now that we are talking about ozone and hyperthermia has been shown to activate lymphocytes.
No question.
And ozone natural killer. So
yeah, but hyperthermia is just a little bit harsh.
Yeah.
Then sauna, for that purpose, I would say that sauna is the better option.
We'll finish off with all the questions of our impact program at the end.
Yeah.
And there's going to be a long, broad ranging topic. Let me get to the ozone and hyperthermia questions. We don't usually talk about this on the webinars, but would it be possible to give me a ballpark figure on the cost here? Yeah, why not? Every treatment is personalized here at Oasis, so giving you a ballpark figure is kind of difficult. But at Oasis we are inpatient, so we kind of include everything in the cost. So it'd be anywhere from $25,000 to about $42,000, depending on the recommendation given to you by our doctors. And in order to get a recommendation, like I mentioned before, you have to give us a call, send us your medical records. We provided free Zoom consultation. We can get you a treatment recommendation personalized together with the ballpark figure price. So the way we kind of work here is that the price of the treatment is what's recommended before you come to Oasis. But everything is modified. So some patients get less treatment, some patients get more treatment, but we work with the patient on a daily basis for that. So like I said before, the more time you're at Oasis, the more personalized and tailored the treatments do come. So I give you a ballpark, but it will change. But we try to get you as close to what you're going to spend as possible. For patients that do surgery, like for example, we need all the medical records so we can give you guys a good estimate of what the surgical costs are going to be. But yes, thank you for that question. And it's something that we want to be very transparent about. Methylene blue, we always get that question now. Methylene blue, mendazole and bendazole. Do you use methylene blue?
Well, it's an antioxidant, and we have much better antioxidants than methylene blue. It's not that it's not good, but there are other things that are much better and easier to use.
All right. There's so many questions. CP is asking, molecular hydrogen gas inhalation upregulates the expression of glutathione. Glutathione is controversial. Does that mean molecular hydrogen gas inhalation is a no-no for cancer patients? That's very specific, CP.
Yeah, if anything that will increase the production of glutathione in a cancer patient is not the best for that patient.
Okay. Do you use cold plunges in your center?
Cold?
Plunges.
Oh, no, we don't use them.
Some patients take cold showers.
Yeah.
Yeah, but no, we do not use cold plunges here at all.
This is not bad. It's just that most of our cancer patients are not in the best condition.
What's plunges?
Getting into a cold pool.
Kind of like the ice bucket. Yeah. Have you ever done a cold plunge?
No.
I have.
Where? Like in the
like in
freezing
a
ocean
spa.
or
No, in the spa where they have, you go to the sauna and then they have this pool that is very cold.
So you go from extreme heat to extreme cold.
Yeah.
It's not fun.
How about you, doctor? Have you never done a cold plunge?
They are cold all the time, so I don't need that.
Yeah. It's funny, sunny California, right? Where the women are always cold here.
Yeah.
Definitely always cold. Let me see. Let's get into the immunotherapy questions. Talk to us about our impact program. I know there's a lot of questions on natural killer cells and dendritic cell-based therapy. So why don't you finish on the?
So we have our impact protocol that stands for immune personalized autologous cell therapy, and it's basically all derivatives of anti-tumor immune therapy. The basis for the impact protocol is generally dendritic cells, and dendritic cells are called antigen presenter cells. And what that means is that when a foe comes in contact with us, the dendritic cells are the ones that will determine what type of enemy or agent is attacking you, and will choose the best agents within the immune system to attack that foe. Tumors, because they grow from our own tissue, they are not viewed initially from our immune system as enemies and will not attack them. Once the tumors are organized and then they become invasive, the immune system can see them, but tumors shield themselves from the immune system and make themselves invisible to the dendritic cells. And so the purpose of our impact protocol first is to unveil the tumor to the immune system. And the way that we do that is that we obtain the antigens from the tumors, and then we create a vast number of dendritic cells in the laboratory, and we will activate or expose those dendritic cells to the tumor antigen that we obtain from tumor circulating cells. And that way, the dendritic cells are able to say, oh, there's a tumor there, and now I'm going to let the natural killer cells attack that tumor. So in a nutshell, in a very easy way to explain, that is what dendritic cell immunotherapy is all about. And then we have other products that can bypass that presentation and attack the tumor directly. So we have about 5 or 6 different products from our impact protocol to help the patients fight their cancers through their own immune system.
Perfect. All right. We're almost at the end, but we have time for more questions. We still have about 5 to 7 minutes. I know that because this time is very important. And before we continue, I want to give a shout out to our staff here, Kevin and Deborah, that this doesn't happen.
Thank you very much.
We love you guys, and thank you for setting everything up. Deborah is Dr. Contreras' daughter, and she helps out around here, and we love her. So she just got married, so congratulations.
Yeah.
Yes.
1 month yesterday, right? Or something like that.
So happy anniversary on your marriage. Anonymous is asking, what is the best treatment for stage 4 prostate cancer? I do not want to do hormones.
No, that's well, we would need to find out how aggressive your cancer is. If you have a Gleason 6, I think that you can continue without hormones, and a treatment like ours would be very beneficial. We have other young patients that have more aggressive tumors where we initially use hormone therapy to bring the activity down. And in our experience, we have had a lot of very good cases where once we bring the tumor under control, we can then continue with the therapy just like ours without hormone therapy. So again, it will depend on how aggressive your tumor is, how advanced, how many metastases you have, if they're threatening, for instance, your bone structure or not. So it's not always possible to have good results without any type of hormone therapy. But what I can tell you is that in the conventional realm in America and most countries, they will say it's hormone therapy forever and that's it. That's not necessarily true. We have very good results where we initiate the process with hormone therapy, but then we can stop it once the tumor is under control.
Doesn't have to be for life.
Right. We would need to evaluate you personally to let you know first if we can treat you without hormone, which is possible. And if we need to use hormones, we can let you know for how long, give you a time frame for that.
All right.
And I think that that's important to see case by case, because in some cases it's not enough to know if it's a stage 4, because a stage 4 can mean just one spot in the spine and you are stage 4, or be just full of tumor activity in the whole spine and still be a stage 4. So that's why doctor recommends to see the case extent and see if it's possible.
Yeah.
All right, guys, it's about time. We're gonna do 2 or 3 more questions. Even though Contreras.
You see?
Yeah. Right.
Yeah, I'm always.
He was not good at math in school.
A little. But I understand that their time is so important and they have so many questions and I want to be a good guy. And we're getting shout outs to Deborah. Congratulations on getting married, Deborah. Yeah. So Jennifer is asking, what is your experience with salivary gland cancer stage 4?
Head and neck tumors, they're all clumped together. We've had very, very good results with our immune therapy. So no matter what the stage, early stages, usually surgery is the best for any tumors of the head and neck. But now stage 4, I don't know if you already had surgery or not, or if you had radiation therapy or chemotherapy, but in any of those cases, we have treated many patients with squamous cell head and neck tumors very successfully.
All right. I'm trying to find a Dr. Paulina Larraga question. Now, this is for you. See, what conditions would make vitamin C not an option? What cancers?
I don't think will be cancers, will be more condition. For example, if you have a kidney acute failure or chronic failure that we need to adjust it, or the most important, that you are deficient of G6PD. That is an enzyme that will cause that your red blood cells will destroy and cause you being jaundice and renal kidney failure. So basically, more conditions more than
and also significant heart failure, because as I mentioned at the beginning or before, the amount of vitamin C that has to go into the body is a gram per minute. It's a lot of liquid that goes into a patient's body in a very short period of time. So if your heart is not up to par, then you are not okay.
Okay. Got it. All right. The last question. I'll make it a good one. And then there's a question for me. So I'm going to end with that one. What do you think about olivarib to shrink or eliminate cancer stem cells? It's a PAR inhibitor to block pathways for I think, BRCA1 gene.
That's very interesting, and we're looking into it. We use metformin because metformin has been proven to kill stem cells from cancer, but there are a couple of natural elements, and this has been promoted by the daughter of a French researcher that found that these natural elements also kill stem cells.
Sylvie Bojansky.
Yeah.
Dr. Bojansky.
And so, yes, there can be other elements, natural elements that can kill stem cells from cancer. Our experience with metformin has been very good. It's very inexpensive, and but there's no question that about 20% of our patients, right, do not tolerate any metformin, and that's why we're looking into other natural elements.
All right. Angel's asking, does your patient have to stay at your center until the cells are multiplied? They don't have to stay here, but it's always recommended. Usually for dendritic cell and lymphokine activated cells, about 6 to 7 days.
Yeah.
And for the natural killer cells, about 10 to 12 days. And for the all-important tumor infiltrating lymphocytes, about 15 to 16 days.
Yeah.
So we always recommend patients staying here. But what we do is while they're being cultivated and multiplied, patients receiving treatment here at Oasis. So yes, Angel. And if, like I said before, if anybody has any questions about how we can help you, what kind of treatment Dr. Contreras, Dr. Larraga would recommend for you, please give us a call. Our number is 888-500-4673. That's 888-500-4673. Or you can go on our website at oasisofhope.com, fill out one of our contact forms, or call us. We have admissions coordinators working during office hours. And go on our Facebook and our Instagram page. Deborah's in charge of that, so make her happy. And everybody from Tijuana to the world, we love you. God bless you, you and your families. And thank you for joining us tonight. We have our next webinar about we don't know if it's 2 or 3 weeks because the holidays are coming up, but our next webinar is going to be on Laetrile.
Excellent. Excellent.
And hopefully John Richardson is going to join us.
That would be great.
Our liposomal proinsulin supplement for Laetrile. And Dr. Paulina, always a pleasure to have you aboard on our webinars. Dr. Contreras, thank you so much. And guys, have an amazing day, an amazing night. God bless you and your families. And thank you again.
Thank you.
Signing off.